Now, could you tell us in a nutshell, where is clinical pharmacy in Northern Ireland now?
Today in Northern Ireland, we have a skilled and growing clinical pharmacy workforce, and they are available to take on the new and advanced practice roles that we really are aspiring to through our strategies. Now, that workforce really is offering faster access to care and services, and so helping to increase capacity within our health and social care, which is one of our key challenges. They're also driving improvements in the safe, appropriate, and cost-effective use of medicines in both primary and secondary care, and optimizing the outcomes for patients. And they're connecting individuals with their essential medicines and offering professional advice and accessible clinical services to treat and prevent illnesses in our community pharmacies.
That's really very impressive. And of course, this includes a large number of prescribing pharmacists. How many exactly?
In Northern Ireland, we have approaching 30% of our pharmacist workforce would be independent prescribers at the moment, and that's growing. And we commission around 150 independent prescribing training course places a year. And that's for our current pharmacist workforce who are already on the register. But in addition to that, from 2026 onwards, all of our new registrants will come out of university and come out of their foundation training year as prescribers with an independent prescribing qualification. And that means we estimate that that is going to increase our number of prescribers in Northern Ireland up by a further 1,000 by the end of this decade. So we're going to have see a tremendous acceleration really in the number of prescribers now in the coming years.
As I said, it's an impressive list. Everyone wants to know how you got the funding to do so much. How did you do it?
So the funding that we secured for improvement and for advancement in pharmacy practice in Northern Ireland didn't happen overnight, and it didn't all happen at the same time. It was really truly incremental, and it involved some small scale investments as well as some very large investments that we managed to secure. And for example, in general practice, we started off in general practice with a small number of pharmacists working in different general practices in sort of legacy roles where they might have been offering prescribing advice. It wasn't a structured employment model, but we started off quite a number of years ago now, I mean, probably 10 years or more, by piloting some more strategic approach to if you place a pharmacist in that environment and then evaluating their impact. And we also commissioned some formal research on the role of general practice pharmacists and their value. And of course, we were doing that at a time when there was a lot of interest in the role of general practice pharmacists across the UK. So other academic institutes were doing the same thing as well. So then in policy, and with me and my team in policy, we were able to look at that evidence both locally and nationally and put together and support business cases for a much bigger scale up of general practice pharmacy. And from 2015 to 2020, I have to say that our commissioners secured sufficient funding to provide every general practice in Northern Ireland with the equivalent of a full-time general practice pharmacist. So tremendous investment, but it started small, build the evidence base, and then scale up and win over the funding. It was a substantial amount of money, and they're fully funded posts. But an important part of that, of getting that business case approved, was that it was approved on an invest to save basis. So that meant that we had to put a case was put forward whereby these pharmacists in those roles would provide benefits financially, as well as in terms of patient safety and also in terms of Other benefits for the practice around freeing up time for the medical colleagues and general practitioners, for example. So an evaluation formed part of that project and part of the business case. And I'm very pleased to say the evaluation did show tremendous benefits and actually it showed that we had a good return on investment, and it also developed that. So in terms of that shows, start with a pilot, look at all your research as well, develop the business case for a larger scale up, but still an emphasis on evaluation and, because it is a significant investment in that one.
Very interesting. So that's general practice. Has this approach also been applied to other sectors?
Other areas as well, where we've had success in community pharmacy, we have been able to expand investment in that sector, particularly in our clinical service, and that is through our Pharmacy First service. And this is a service that allows members of the public to seek advice for a range of common illnesses, as well as contraception and urinary tract infections, and now sore throats as well. And they can visit the pharmacy for an assessment and treatment if needed, without the need to go to see a general practitioner. And that is allowing community pharmacists to really develop their clinical skills, and that service can run either as a prescribing service or through the use of patient group directions where needed. And that service we have been building up, and we intend to build up further, and we're doing it incrementally. And again, we're taking the same approach: pilot an area, evaluate it. For evaluation, we use the Medicines Optimization Innovation Centre, which is an innovation centre that is commissioned by the Department of Health. And they provide a very robust evidence base that is then used to inform business cases to take to commissioners, because it's competitive. We have to prove that these services will have an impact, and they will have a beneficial impact. And we've got a very effective approach to service development and community pharmacy now that has developed over recent years, and a really effective innovation pipeline there. But that's two examples of how we've had we really have had good success in getting money into the sector.